Hi, this is Debbie Garcia, and I will be conducting today the bone video axial skeleton assignment. The axial skeleton is the axis or center of the body, is a straight line drawn from the head to the space between the feet passing through the body center of gravity. So I'll be basically demonstrating the areas of which we were assigned. The cranial bone is basically on the top of the head, or the cranial bones is basically all of the head. The frontal is the top of the head. The parental is the side of the head, and the occipital is the back of the head. The external occipital protuberance is a bony protrusion or bump where the muscles that keep the head upright and allows the head to tilt back and forth, or to tilt backward. The temporal section is the area we'll be hitting next, is the external view, is the temporomandibular joint, is kind of in the higher cheekbone areas. I apologize if I'm using more simplistic terms here. The mastoid process is more in this area here. The styloid process is a bone underneath. Unfortunately, I can't see it on this model here, but it looks kind of a tooth-like bone in this area here. The external acoustic meatus is right below the earlobe, so it'd be in this area. And the squamous part is basically right here in the middle of the head here. The third part of the internal view is the petrous part of the temporal bone. That is the interior surface forms the posterior part of the middle cranium fossa. And it's basically inside of the mastoid in this area, in the center of this area here. If I take the head off, then I won't be able to get it back on. The internal acoustic meatus is a canal within the temple bone that transmits nerves and vessels from within the posterior cranial fossa to the auditory apparatus, and that's in the temporal area, and that would be in the backer area, in this area here. The sphenoid is the external view, is the lateral and orbital parts, greater wing next to the eyes. It'd be actually more in this area here. And its superior and inferior divisions of oculomotor nerves, trochlear nerve, lacrimal, frontal, and nosocomial branches of the ophthalmic and abductions nerves. And these are superior and inferior divisions of the ophthalmic vein, which in turn is the inferior division, also passes through the inferior orbital vessure, and the sympathetic fibers from the canaries pallidus. And then inside of it, unfortunately, was the internal view of the lesser wing and the greater wing. The optic canal transmits in here the optic nerve and ophthalmic artery with accompanying sympathetic nerve fibers into the orbital cavity, which is the cellular tusia holds the cellular tusia holds the pituitary glands. The next section is the ethmod, which is the area behind in this area here, and that's the crystal galli, which helps secure the brain in the cranial cavity. And the cribriform plate passes the olfactory nerve filaments from the nasal cavity in this area there. The sutures is the next section, and it's the frontal bone, occipital bone, 2 parental bones, 2 temporal bones, 3 bones. These bones are held together by strong, fibrous, elastic tissues called sutures. The corneal is the top of the head. The sagittal is the middle of the head. The lambdoids, or the temple, I'm calling it the temple, I know that's incorrect. And the squamous is in the temporal area there. And then next we go on to the 7 facial bones, and that's the maxilla. It's a kind of the cheek area, the maxilla and alveolar process, which is next. It's in kind of, in this area here. And then the nasal area. And the zygopac is an arch or the cheekbone, which is basically formed by the zygomatic process of the temporal bone. It's a bone extending forward from the side of the skull over the opening of the ear, and the temporal process of the zygomatic bone, the side of the cheekbone, is the ichthyomod. And in that area afterwards is the vomer, and that's the bony part is the major part of the spectrum that consists of the pituitary plate of ethmon and the vomer bone. And the inferior nasal concha is basically when the air passes through the turbinates, the air is then churned against these mucus-lined bones in order to receive warmth, moisture, and cleaning. And we will go on to the next section, which is the mandible. And the body of it is the lower part, basically, of the mouth. The angle is the jawline. The ramus is basically in the in this area here. The mandible condyle is actually in this part here. The mandible notch is actually, that was the mandible condyle. This is the notch, and then the cornea process is within this little area here. We move on to the 9 vertebral column, which is basically the back area. And I'll point out to the 4 points of the adult vertebral column, which is basically the cervical, and then the chest area, and then the lumbar, and then the sacral. The adult vertebral column presents four anteroposterior curvatures, the thoracic and the sacral both concave anteriorly, and the cervical and lumbar both concave posteriorly. The thoracic and sacral curvatures, termed primary, appeared during the embryonic period proper, whereas the cervical and lumbar curvatures, termed secondary, appear later in life, although before birth, and are ascended in infancy by support of the head and by the adoption of the upright position, posture. The cervical vertebrae are numbered with the first 4. The first one is basically C1, and it's located closest to the skull, and the higher numbered vertebrae, C2 to C7, proceed away from the skull and down the spine. The atlas is articulated with round condyles that form the inferior aspect of the occipital bone. That's basically the motion of moving the head side to side. What is unique about the transverse process is that it's dependent on its locations within the spinal cord. The next area is the thoracic vertebrae. There are 12 thoracic vertebrae basically in this area here. The spinous process is the little tips here. The transverse process are these areas in here. And the intervertebral foramens are the middle part here. These are the root of each spinal nerve. The dorsal root's ganglion, the spinal artery of the segmental arteries, and they communicate the veins between the internal and external pleurisy, recurrent Mendelian nerves, and the transformal ligaments. And then the body of the position of the intervertebral discs are in here. And then the lumbar vertebrae, there are 5 vertebrae between the rib cage and the pelvis and the sacrum, and there are vertebral columns usually consisting of 24 articulating vertebrae and 9 fused vertebrae in the sacrum and the coccyx. We go on to the sternum, which is in the middle of this area in here. And then mandiburum is in this basically area. The body is this area. The xiphoid process is towards the bottom, and the jugular notch is on the top of the sternum. There are the true ribs, and then up here, and then the false ribs, and these are the elastic, and then the curve, and then the side. There is an articulated facet on each side of the thoracic vertebrae. Thank you very much. I appreciate your time and attention in viewing this video. I appreciate it. Thank you.